220 Kush deaths, Freetown's mayor versus government. Welcome to the Bold African Voice, BAV, where we ask the questions others are too afraid to ask. Across the streets of Freetown, whispers of 220 dead bodies have ignited a storm. I'm your host, Ahisatu Kamara Kargbo. The mayor says the victims fell to Kush, the synthetic killer drug ravaging Sierra Leone's youth. The government demands proof. But behind the controversy lies a deeper question. How did Africa's sons and daughters become the victims of a chemical war? In a dramatic turn of events, the Ministry of Local Government and Community Affairs, Sierra Leone, has formally demanded that Yvonne Aki-Sawyerr, the mayor of Freetown, provide verifiable proof for her public claim that the Freetown City Council, FCC, had collected 220 dead bodies from the streets of the city, all allegedly killed by the synthetic drug known as Kush, Sierra-loaded. The official letter, dated 9 October 2025, highlights grave concern over the claim, described as a serious and unverified claim, and sets a 5-working-day deadline for the mayor to submit. A comprehensive list of the alleged 220 deceased persons. The locations and dates where their bodies were recovered. Medical or post-mortem reports proving Kush was the direct cause of death. The legal authority under which the council conducted the retrievals and investigations. The ministry warns that failure to provide such evidence will compel the ministry to take appropriate administrative and policy measures. The claim, the context, and the uncertainty. Mayor Aki-Sawyerr
2 weeks ago, maybe 128 on we own side, where we bear that no accounts for the one day we no go see. If we did talk about human capital development being a priority, and we get young people to die on the streets, and it don't become so common, something don't go very, very wrong with society. For let it become normal, for let we see death on the streets. We don't dehumanize. We own picking them. And this don't happen under this government. A government where we say they prioritize free and quality education and human capital development. The one day where we for educate. The one day where then capital we for develop. Now then they lay down the street. Lifeless, hopeless corpses. This na crisis. And we all know what's in the cause. We all know this na death by Kush. You know be in the Yeri then continental. Today, Google Sierra Leone. You see narcotics. They come up as a word associated with Sierra Leone. I don't know if your reporter tell you, when economy office that day, now be a horrific moment because Thamesmed, where now the head of the burial team, where we don't get for create, imagine we know they Ebola, but because of the frequency of the deaths, we actually been get for create a burial team. That day, I called Thamesmed economy office so that when our reporters then go able to talk to him one-on-one. He say, Mayor, he say, one day, dong, just front we office now. You know what he say? It is struggle for die. That's for be pain. Now the heart of anybody where they in leadership in this country. For no say we youth and they lay down on the street on their own, the struggle for die. How can this be okay? Where the fight against this occurrence? We know say the supply of Kush in this country. We did see the news reports. So many reports that not be done. And you know, let me not think say it not go affect me. This tier they affect anybody and everybody. Today is the 7th of October. We don't pick up 220 bodies. As of today, January to today. I talked to the head of the burial team, and again, as I don't point out, we don't get calls for create a burial team. That's therefore be a cause for alarm.
Has repeatedly sounded the alarm on rising deaths linked to Kush in the city. For example, in a letter dated 17th in September, she noted that the FCC had collected 142 corpses from the streets since the start of the year as of 13 August, mostly young people, and described the situation as deeply troubling. AYV News. To add to the drama, earlier coverage by the Sierra Leone Telegraph reported the mayor stating dozens of dead bodies collected monthly in Freetown, attributed to Kush abuse, the Sierra Leone Telegraph. International coverage, e.g. The Economist, notes a terrifying synthetic drug surge in Africa, with Sierra Leone prominently featured. The Economist. At first glance, these numbers seem shocking. Chalk them up to a public health emergency or perhaps political drama, or maybe a bit of both. The problem: there is no publicly available, independently verified dataset that confirms 220 dead bodies, all caused by Kush in Freetown during this period. Thus, the ministry's demand: is this an accurate reflection of reality, or an overstatement that risks undermining public trust and institutional credibility? Why this matters, and yes, a bit of dark humor. Why it matters. Public health risk. If indeed hundreds of people are dying because of Kush abuse and being collected in the streets, then Freetown faces a major drug epidemic disaster. The implications: treatment centers, policing, community interventions, mental health crises, etc. Institutional integrity. The claim places the Freetown City Council in a major role, body collection, burial, etc., and invites scrutiny of how well local and national government coordinate. The ministry's pushback signals intergovernmental tension. Public confidence. If urban citizens believe that young people are dying in the open and that local authorities are not properly handling it, or worse, exaggerating it, then trust erodes. That's bad for governance, and even worse for people who need help. And for a touch of humor, bear with me. Imagine you're the mayor and you get up in the morning and your street sanitation team says, "Boss, we picked up 15 bodies last night. Seems like another Kush weekend special." You might think, cool, maybe statistically this is a wake-up call, but then you check the legal footnotes and discover your team is also supposed to pick up stray goats, abandoned washing machines, and occasionally an oversized boa constrictor. Okay, maybe not that last one. Suddenly, all those 220 bodies sound less like a forensic catastrophe and more like an RPG quest gone wrong. In short, the claim is dramatic, potentially valid, but the checks and balances are raising eyebrows. And in public health crises, drama plus missing data could risk of panic or misplaced resources. Africa-wide comparison. Is Freetown an outlier or part of a regional trend? Across Africa, synthetic drug challenges are rising, but the kinds of numbers being cited in Freetown seem unusually high, or at least unusually documented, in the local context. Regionally. The Economist article maps a synthetic drug surge in Africa with hotspots including West Africa, where cheap imports and weak regulation combine. Sierra Leone's situation is singled out. The Economist. Many African governments face similar issues: cheap synthetic opioids, cocktails of tramadol, fentanyl, etc. But street corpse collection linked clear-cut to drug cause is relatively rare as an official claim. Comparison with other capitals. In e.g. Lagos, Dakar, or Abidjan. Yes, drug abuse and overdose deaths are known. Yet I did not locate credible published figures of hundreds of street corpses attributed to a single synthetic drug in a defined geographic area during a short period. In Sierra Leone's case, the claim 220 bodies is large relative to recent annual baselines. The mayor's own earlier statement: fewer than 50 an annual average prior to this surge. AYV News. In some countries, e.g. South Africa, overdose epidemics are documented, but they are primarily reported differently. hospital admissions, recorded overdoses, rather than bodies in the streets collected by city council. So what can we infer? Freetown may be experiencing an extraordinary outbreak, which would make the claim valid and alarming. Alternatively, Freetown may be highlighting or amplifying what other cities quietly suffer, perhaps driven by local politics, media attention, or innovation in municipal response. Or this might represent a data definition issue. Are all 220 deaths identifiably caused by Kush, or are they suspected Kush-related with varying levels of proof? The ministry's letter suggests the latter concern, serious and unverified claim. In any case, the comparison suggests that while the phenomenon of synthetic drug deaths is continental in scope, the visibility and reporting style in Freetown is unusual, maybe even pioneering in its bluntness. Forward-looking, what next? And where should Sierra Leone and Africa head? For Freetown, Sierra Leone. 1. Audit and verification. The FCC and the ministry should establish a credible database, names, dates, causes, investigations. Whether the number is exactly 220 or somewhat lower higher, what matters is transparency. 2. Medical investigations, forensics. If bodies are being claimed as Kush deaths, pathology, post-mortem, or toxicology needs to underlie it. Otherwise, we risk broad brush attribution. 3. Policy and resource response. Whether the numbers are 220 or 150 or 80, the trend appears upward. That means scaling rehab services, street outreach, policing supply chains, and socioeconomic interventions. 4. Intergovernmental coordination. Local councils, national ministries, police, health services must align. The current friction is counterproductive. 5. Communications and public trust. Authorities need to strike a balance between urgency and accuracy. Over-alarmist claims without proof risk credibility loss. Too little alarm risks inaction. For Africa and globally. Cities should benchmark how many street deaths are being attributed to synthetic drugs. Are councils collecting data? Are bodies being recorded by cause? Develop early warning systems, monitoring upticks in unexplained deaths. ER admissions, street corpses can signal emerging epidemics. Focus on supply chain disruption. Many synthetic drugs spread because regulation, border control, corruption gaps exist. Understand the social root causes. Unemployment, youth alienation, poverty, trauma often drive drug uptake. The Kush crisis isn't simply about the chemical. It's about the context. Use humor carefully, not to make light of tragedy, but to engage youth in prevention messaging, e.g., Kush, the only thing you should not score tonight. Critical reflections. What are the tensions and what should we watch for? Tension 1. Urgency versus evidence. Mayor's claim, bold, dramatic, perhaps necessary to wake up the system. Ministry's demand, caution, verification, avoid panic. Question. If we require perfect proof before action, we may delay interventions. But if we act on unverified claims, we may misallocate resources or erode trust. Tension 2. Local council role versus national mandate. The Freetown City Council appears to have been doing body collection and burial work traditionally, but the legal basis and public health responsibility may lie with national health police agencies. The ministry letter questions the legal authority under which the council carried out retrievals. Sierra loaded. This poses operational risk. Who handles street corpses? Who investigates cause of death? Who funds burial? Tension. 3. Numbers as policy tools. 220 is a scary figure. It grabs headlines. But if later found to be inaccurate, say after verification it's 120 or 300, then the narrative may suffer. Numbers become political weapons. The key: use numbers to trigger action, but anchor them in data and transparent methodology. Tension 4. Stigma, youth, and community engagement. dead youth street side, ours social breakdown. But if the narrative becomes street kids died of Kush without addressing context, we risk blaming victims and neglecting root causes. Prevention needs community-led programs, safe spaces, alternatives to despair, not just policing of drugs. The saga of the claimed 220 Kush-related deaths in Freetown presents a striking microcosm of the broader synthetic drug challenge in Africa. Dramatic numbers, blurred lines between cause and correlation, fragile institutional coordination, and the need for urgent action. Whether the figure 220 holds up, and that remains to be seen, matters less than the underlying trend. Young people dying, substance abuse exploding, municipal systems being overwhelmed, and national institutions scrambling for a coherent response. What we should watch next. Will Mayor Aki-Sawyerr submit the requested documentation within the 5-working-day deadline? Will the ministry verify and publish the findings or the discrepancies? Will the FCC's body collection suspension, noted in recent reports, become a flashpoint for who picks up corpses in the capital? Will other African cities step in and say, "Hold up, we have the same issue. Are you verifying it like Freetown claims to be?" And most importantly, will survivors, families, and vulnerable youth get help, rehab, counseling, economic opportunity, rather than just standing statistics in a bureaucratic letter? Rehabilitation and mental health response in Sierra Leone. In the wake of escalating reports linked to the synthetic drug known locally as Kush, the section of Sierra Leone's health system tasked with rehabilitation and mental health support has been scrambling to catch up. Current state of play. According to a recent piece in The Lancet, youth substance use is rising in Sierra Leone, yet the availability of mental health facilities, treatment services, and skilled professionals remains very limited. The Lancet. The World Health Organization has publicly flagged Kush as a high, dangerous, and addictive new drug substance in circulation in Sierra Leone, a potent combination of marijuana, fentanyl, and tramadol. WHO, Regional Office for Africa. A ground-level account. The once derided Crace Yard Psychiatric Hospital in Freetown has recently undergone a transformation. More psychiatrists, new nurses, addiction specialists, but remains overwhelmed. The Associated Press. The government, via the Ministry of Social Welfare Sierra Leone, launched a rehabilitation center in February 2024 to address the escalating issue of substance abuse, particularly the prevalent use of Kush. Sierra Loaded. Community-based initiatives are also active, e.g., the Advocacy for Youth Mental Health and Empowerment, AYMHE program, working in schools and community centers across the country, training youth leaders and educators for one-on-one support sessions and interactive prevention. Being Chake, Grand Challenges Canada, Key Gaps and Challenges. 1. Scale is too small. Treatment centers exist, but their capacity is tiny compared to the apparent magnitude of the issue. As one Guardian report put it, it's like smoking poison, Sierra Leone's youth battle addiction to a mystery drug. The Guardian. 2. Evidence and tracking lag. Without rigorous data on cause of death, substance composition, and treatment outcomes, the system is flying somewhat blind. 3. Stigma and informal care. Many addicts and families default to non-medical responses, volunteer-run centers, chains, isolation, rather than formal health services. Voice of America. 4. Coordination across levels. As with the dispute between the local council and ministry over the 220 deaths claim, the multi-layered governance of health, recovery, policing, local government remains fragmented. 5. Prevention. Plus socioeconomic root causes. As pointed out in the UN Town Hall in Freetown, youth unemployment, despair, and lack of opportunities make vulnerable populations ripe targets for synthetic drug pipelines. The United Nations in Sierra Leone. What to watch next? Will the rehabilitation center's throughput increase significantly? Beds, staff, funding in 2025 to 26? Will the government publish disaggregated data on Kush-related admissions, mortality, post-treatment outcomes? Will prevention efforts scale? More youth outreach, peer mentors, school-based programs? Will coordination improve? Local councils, ministry, police, health services aligning protocols and legal mandates? West Africa comparison? Is Sierra Leone unique? Let's step back and compare Sierra Leone's situation with broader West African trends to see whether Freetown is an outlier, leading edge, or simply part of a larger wave. Regional trends and data. A systematic review of substance use in West Africa finds that while cannabis remains the most widely used illicit drug, prevalence 5.2%, 13.5%, the region is seeing rising use of amphetamine-type stimulants, benzodiazepines, and synthetic opioids. PMC. A recent Lancet Global Health Style article highlights that several West African states face an opioid crisis, with trafficking and consumption of fentanyl-type and nitazene substances rising. The Lancet. The United Nations Office on Drugs and Crime, UNODC, notes a shift. Local drug markets in Africa are rapidly diversifying, shifting from a predominance of domestically sourced cannabis to a multitude of transiting drugs. Reuters. Country comparisons. Ghana. Widespread recreational use of tramadol, especially among youth, but fewer publicized claims of mass deaths on the scale of 220 in one city. Nigeria has seen large seizures of opioids, but treatment infrastructure is still weak and data on street corpse drug deaths is largely unreported. PLOS. Guinea, Liberia, the Gambia. According to a 2025 Klingendale Institute report, Kush has spread from Sierra Leone into neighboring states, with thousands of deaths likely, but verification remains weak. Klingendale. What this tells us. Sierra Leone's claim of 220 deaths in one city tied to Kush may indeed reflect a harsher or more visible outbreak than in many neighboring states, but that could also reflect better reporting or more dramatic claims, rather than strictly worse incidents. Treatment systems in West Africa are uniformly under-resourced. Sierra Leone may be ahead in declaring the emergency, but not necessarily in managing it. The comparison emphasizes that the issue is regional, not isolated to Freetown. Supply chains cross borders, youth vulnerability is common, and institutional capacity is thin. Politics, narrative, and the perils of numbers. The 220 deaths claimed by the Yvonne Aki-Sawyerr, mayor of Freetown, and the subsequent demand by the Ministry of Local Government and Community Affairs, Sierra Leone, for verification touches on deep tensions in governance, statistics, accountability, and yes, politics, key issues at play. Governance roles. The letter from the ministry questions the legal mandate under which the city council retrieved corpses, suggesting an overlapping responsibility between local and national tiers. The mayor's assertion effectively put the city council in a quasi-forensic role. Numbers as political tools. Claiming 220 died from Kush is a powerful headline. But if the number is later shown to be inflated or based on weak evidence, institutional trust can erode. The ministry's demand for evidence reflects this risk. Public panic versus neglect. On one hand, alarming numbers may spur action, mobilize resources, and raise awareness. On the other hand, they may cause panic, stigmatize communities, or justify heavy-handed responses. Media, narrative, and youth. In interviews and coverage, youth affected by Kush are depicted in stark terms. Zombie-like, digging graves, slumped in alleys. These vivid images can shape public policy, but also risk oversimplifying complex social issues. AP News, critical perspective. The mayor may have intended to shock stakeholders into action, and perhaps it worked, But effective policy needs more than dramatics. It needs clear data, tracing of supply chains, support for survivors, and long-term funding. The ministry's demand for proof is arguably legitimate. If the claim is unverified, it can undermine not just the mayor's credibility, but also the standing of national institutions like the Task Force on Substance Abuse. We must ask, what does the 220 bodies count mean? Are they all scientifically linked to Kush? What is the time frame? What proportion of all street deaths do they represent? Without this context, numbers wander in the land of rhetoric. The risk: we get caught up in body counts and acrimony between levels of government and forget the people behind the numbers. Addiction is not just a metric, it's human lives, families, lost opportunities. A forward-looking roadmap: what needs to happen? Short term, next 6 to 12 months. 6 to 12. Verification of data. The mayor's office and national ministry should collaborate to publish a validated list of cases, names anonymized if needed, but dates, locations, cause, or suspected cause should be documented. Transparency builds trust. Rapid expansion of treatment. Scale up beds, trained staff, decentralized centers beyond Freetown, mobile outreach into hotspots. Emphasis on youth, especially those aged 18 to 30. Emergency supply interruption. The state, with regional partners, must identify and cut supply chains of Kush precursors. Given West Africa's role as trafficking corridor, this is critical. Public awareness campaign. Using youth-friendly media, social influencers, peer educators to demystify Kush, challenge glamorization, provide credible support paths. Medium term, 1 to 3 years. Build data systems. Develop and maintain an observatory for drug deaths, overdoses, street recovery operations, admissions. Sierra Leone could become a model in West Africa rather than an outlier. Intergovernmental coordination protocol. Clear roles for municipal councils, national ministries, police, health services. Legal frameworks clarifying who does body collection, investigation, cause linking. Youth economic empowerment. As the UN pointed out, the youth vulnerability is partly economic. Aftercare should include skills training, employment programs, entrepreneurship support, so that addiction is not simply medicalized, but socially addressed. Regional collaboration. Sierra Leone should lead, join formal regional networks, ECOWAS-led West Africa Commission on Drugs, to share intelligence, best practice, cross-border interventions. Long-term, 3 to 5 years and beyond. Harm reduction policy framing. Rather than treating all users as criminals, shift towards treatment, decriminalization of users while punishing pushers, as recommended by the West Africa Commission on Drugs. Research and forensic capacity. Invest in labs that can analyze drug samples for nitazines, synthetic cannabinoids, trace ingredients, so the Kush causes death can move from claim to scientific fact. Community resilience model. Embed peer support networks, community mental health coalitions, e.g., City of Rest in Freetown, into the mainstream system. Mental Health Coalition, Sierra Leone. Monitoring and adaptive policy. Policies should not be static. As the drug market evolves, e.g., next monkey tail, Gaddafi, or whatever variant emerges, Sierra Leone and its neighbors must be agile. Supply chains, chemistry, and the anatomy of the Kush epidemic. To understand the claims around 220 alleged Kush-related deaths in Freetown and the associated demands for evidence from the national government, we must dig deeper into how Kush is made, trafficked, consumed, and why that matters for both the legitimacy of the numbers and the policy response. What is Kush? According to recent investigations by the Global Initiative Against Transnational Organized Crime, GITAC, and the Klingendale Institute, Kush is not simply marijuana dressed up in a new name. It is a synthetic drug blend whose core components include potent synthetic opioids, notably nitazines, some of which are 25 times more potent than fentanyl, or synthetic cannabinoids, chemicals that mimic THC but with far more unpredictable effects. The mode of consumption often, the synthetic chemical is sprayed or infused onto plant leaves, sometimes marshmallow leaves or other cheap vegetable matter, then smoked. Global initiative. The market for Kush is highly fragmented, smaller actors, local lab synthesis, online ordering of precursors. Day. One jaw-dropping twist. In many media reports, the drug is alleged to include ground human bones, formaldehyde, acetone, paint thinner, and other embalmment-adjacent substances. While the scientific evidence may be less clear on every component, the rumor and some qualitative studies highlight the grotesque possibility. How does it get into and circulate through Sierra Leone? Precursors or even finished products are shipped by maritime container or postal courier from origins including China, the Netherlands, the United Kingdom. Local labs in Freetown may then produce or mix the drug. Easier entry, cheaper cost, lower barrier to manufacture, ISS Africa. Its cost is extremely low. One joint in Freetown might cost you as 0.25 or equivalent and be shared among 2 or 3 users. Enact Africa. Because of low cost, high potency, and weak regulation, the drug infiltrates vulnerable youth populations and informal economies. Implications for the Freetown numbers claim. Given this supply chemistry picture, high potential for harm. With nitazines involved, overdose risk is real and acute. The notion of hundreds of deaths, as alleged, is plausible in the abstract. But because the manufacturing and distribution are highly decentralized and unstandardized, verification becomes difficult. If many bodies are found in the streets, linking cause of death to Kush versus other causes is very challenging. Data gap explains caution. The Central Ministry's request for proof, the list of 220 dead, medical post-mortem reports, etc., is highly rational given this context. Without standardized toxicology, we risk conflating found dead near drug use with died from this specific drug. Politics and narrative. A local official using blunt numbers, 220, may be trying to catalyze action, but in a drug market, this murky blunt claims risk credibility if not backed up. On-the-ground realities, lives behind the numbers. While policy and supply chains matter, the human dimension is essential and grim. Reports describe young men slumped in alleys, absent from families, suffering organ failure, or completely incapacitated. AP News. One young man told a media team, "The Kush, it's more powerful than anything I've tried before. I've seen people fall and never get up." Le Monde. Key points. The epidemic touches youth unemployment and hopelessness. Lack of opportunity makes vulnerable young men especially susceptible. Enact Africa. Some families resort to extraordinary, even cruel tactics, chaining addicts, confinement, non-medical interventions due to lack of formal services. AP News. The social costs. Family breakdown, increased crime, youth dropping out of school or work, increased load on psychiatric services. These human realities help explain why local officials might inflate or emphasize high figures to trigger action, but also why national authorities demand more caution, because inaccuracies risk human trust and institutional credibility. Connecting the dots. The Freetown 220 claim in light of evidence. Putting everything together. Given the epidemic described by multiple sources, it is not implausible that several dozen deaths, or even more, linked to Kush have occurred in Freetown in recent years. However, the claim of exactly 220 bodies collected from streets all confirmed as Kush-related deaths is very ambitious given the data limitations. The National Ministry's demand for list of bodies, dates, locations, medical post-mortem evidence, legal authority for retrieval, is aligned with the kind of rigor needed in such a murky environment. The tension, then, is understandable. Local urgency versus national verification, dramatic numbers versus cautious governance. For the mayor's claim to strengthen institutional response and public trust, it needs follow-through, transparent documentation, collaboration with national forensic health agencies, public communication of findings, even if the number changes. If the number turns out to be exaggerated, there is a risk that the broader Kush response, rehab centers, funding, youth outreach, could be undermined by skepticism. Ground reality, community case studies, and forensic gaps. To gauge whether the 220 Kush-related deaths claim holds water, it helps to descend from the lofty heights of press releases into the gritty streets of Freetown, Crew Bay, Susan's Bay, and Dwarzark, where the fight against Kush is both personal and painful. The community voices. At Crew Bay, 24-year-old Sori, not his real name, sits slumped under a zinc roof shack. "I lost 2 of my friends this month," he says. "One just collapsed after smoking. We called for help, but by the time we found a car, he was gone." At the City of Rest Rehabilitation home in Grafton, a counselor estimates that 3 to 5 new cases arrive daily, most between ages 18 and 30. "Some days, it feels like a war zone," she says. "We don't have enough beds, but families keep showing up." Local undertakers in Wellington confirm that unidentified male corpses, often young and emaciated, are being buried weekly. Yet few of these cases ever undergo a toxicological test or autopsy, meaning their cause of death remains assumed, not proven. The forensic capacity problem. Sierra Leone's medical infrastructure, still rebuilding after Ebola and COVID-19, has only one main forensic pathologist serving the entire country. There is no accredited toxicology lab capable of testing for nitazenes, synthetic cannabinoids, or novel opioids like those found in Kush. WHO 2024. So when the Ministry of Local Government demands medical or post-mortem reports proving Kush was the direct cause of death, the irony is unavoidable. Such reports barely exist because the state lacks the tools to produce them. In short, Mayor Aki-Sawyerr may have been right about the death toll's direction, catastrophic, but wrong about the precision. Her claim reflects a humanitarian scream for attention, not a forensic audit. The bigger picture: governance, accountability, and public trust. The dispute between the Freetown City Council and the central government mirrors a deeper African problem. When data disappears, politics fills the vacuum. Governments across Africa, from Freetown to Nairobi, Lagos to Monrovia, struggle with a credibility paradox. Citizens mistrust official silence, while officials mistrust unofficial truth-tellers. The ministry's caution is technically justified. The mayor's alarmism is emotionally justified. But when caution meets urgency, the result is paralysis, and bodies, verified or not, still pile up. What should have been a united public health effort instead risks turning into a blame game, where one side accuses the other of propaganda while young lives continue to burn out like cigarette ends in alleyways. Africa-wide reflections, parallels, and lessons. Across West Africa, the Kush epidemic underscores a chilling pattern. The African drug crisis is no longer an import, it's homegrown. In Ghana, tramadol use remains rampant, with cheap smuggled pills turning ordinary youth into silent addicts. In Nigeria, monkey tail, a local cocktail of cannabis soaked in gin and codeine, fuels similar destruction. In the Gambia, Kush has now been reported as a national emergency, with the government calling for ECOWAS-level intervention. The Guardian, 2025. Each country tells the same story: weak regulation, porous borders, idle youth, and reactive leadership. The 220 bodies in Freetown could easily be 500 in Lagos or 300 in Accra, only no one's counting. Advice to African leaders. 1. Don't wait for numbers to become headlines. When leaders only act after public outrage, they surrender initiative to crisis. The time to respond to Kush, tramadol, and other synthetic scourges was yesterday. 2. Invest in science, not slogans. Forensic capacity, laboratory infrastructure, and evidence-based policymaking are what separate truth from speculation. An unverified claim, however emotional, helps no one if it can't be proven. 3. Treat addiction as a health crisis, not a crime. Prisons don't cure dependency. Rehabilitation, counseling, job programs, and community engagement do. Criminalizing users only deepens the cycle. 4. Strengthen local governance, but clarify mandates. Local councils like Freetown's are closest to the people, but they need clear legal frameworks and funding, not reprimands. Coordination beats confrontation. 5. Lead with empathy and data. The next time a mayor, doctor, or journalist raises an alarm, don't rush to punish, rush to verify. A collaborative fact check saves more lives than an administrative letter. Summary of key messages. 1. The Kush crisis is real. Whether the number is 220 or 120, Sierra Leone's youth are dying in alarming numbers, and official denial only fuels the fire. 2. Verification matters. Unsubstantiated claims erode credibility, but lack of investigative capacity makes precision nearly impossible. 3. This is a regional epidemic. From Sierra Leone to Ghana and Nigeria, synthetic drugs are tearing through the social fabric, fed by poverty, hopelessness, and weak enforcement. 4. Policy coordination is the missing link. Local urgency must meet national structure. Without cooperation, efforts collapse into confusion. 5. The future depends on balance between emotion and evidence, politics and compassion, enforcement and rehabilitation. Final thought. Africa does not need another generation lost to chemicals disguised as comfort. It needs leaders who can turn cries for help, whether from a mayor or a mother, into measurable action. Because behind every statistic is a name, and behind every unverified death lies an unfulfilled dream. Thank you for watching The Bold African Voice, BAV. Where Africa speaks boldly and the world listens, the Kush crisis is more than numbers. It's a wake-up call to African leaders, communities, and families. If Sierra Leone's story teaches us anything, it's that silence is deadly, and leadership must start with truth. Don't forget to like, share, comment, and subscribe. And join us next time as we uncover the stories behind the numbers. Together we speak truth to power, boldly and unapologetically.